So if you want to then just, state the time, the name of the meeting, who's present, that you have a quorum and all that stuff. It is recording, and then go into what you were doing. And then
No problem.
I'm checking out. I'm going to make Naomi host, and then I'm checking out, okay?
Thank you.
Okay,
All right.
thanks.
Thank you.
Jeremy.
Yep.
All right, good evening, everybody. Right now is 7:02. All right, and this starts tonight's Health and Equity Committee joint meeting. And this is a special meeting regarding vaccines. We're gonna have a presentation. I want to start out by saying that who's present right now? We have myself, we have Naomi, we have Edit, we do not have Lisa, and that's the Equity Committee. Well, from Health Committee, we have Joseph, we have, I don't believe Sandra. Sandra's not on, correct?
No, she's not.
Okay.
Sandra's not on?
Maybe she's having trouble.
Okay.
Yeah, I had some trouble logging in. I was here for about 5 minutes trying to log in.
All right.
Is Joanne?
Yep.
in?
I'm here.
Okay. Manley? Is Hazel in?
Yes, Hazel's here.
Okay.
All right, we do have a quorum. We do have a quorum tonight.
Try to call
Okay.
Sandy.
Okay.
Sandy. All right.
All right, and then we have from another member for the committee, we have Andrea Siegel, from the community board. She's also joining us tonight. And from the members of, the medical interns from Albert Einstein School of Medicine is also joining us to do the presentation tonight, which is, we have Alex and Carol.
Then
All right, and then the younger gentleman there with the headphones on. What's your name, sir? Michael. Are you the member of the public?
He's muted.
All right, let me unmute Michael.
Dr. Reichgott, I think they're asking you.
Oh, that's the doctor? All right. So he's a part of your team?
Yes, he's a professor here at Einstein and a physician.
Welcome, doctor. Thank you.
the doctor.
All right, I see another person that has got on, Margaret. So is this a member of the public? Okay. Okay, 1 second.
Sandy isn't on yet?
All right, we'll just give it 1 more minute. Let somebody hop on.
Okay.
Edit, do we have anybody that's gonna take notes?
Can't take notes, sir. I'm sorry.
Oh, you
Hold
can't?
on. Sandy is on. She says she's on via phone.
Okay, good. That's good.
Okay, no problem. All right, gotta go. Okay, bye. Sorry. If you want me to take notes, I'll take notes.
Yes, Joanne, can you take our minutes tonight?
Sure.
On the onset of the call, Naomi, we said 7:03, correct?
Yep. 7:03.
Perfect. All right, so that begins tonight's Joint Equity and Health Committee meeting. I want to start out by approving. I wanted to put a vote on it. I wanted to put a motion to approve our March minutes for our equity meeting last month in March. So all the people that's on my committee, all in favor, say aye.
Aye.
All right. Motion passed to pass our minutes for our last month's meeting. So thank you so much for the minutes, and that should be up in should be on the website soon, on the CB11 website. All right. For Mr. Bako, do you want to pass some minute meetings for your last month's meeting?
We did not meet.
Oh, you didn't meet?
No, we did not.
Okay. Not a problem. I'm assuming you passed your minutes for February?
We didn't have a meeting in February either.
Okay, sir. Thank you. All right. So tonight's
Joel, I have a question. This is Sandy.
Sandy,
Who is
go
the
ahead.
backup? You're leading it. I think Hazel should be the co-chair of this meeting from the health committee, since this is a joint committee. Is
Absolutely.
Hazel on yet? Is she on
Absolutely.
yet? Thank
I
you.
saw her.
Yeah, I thought I heard her.
Yeah, I can't get on via my regular computer. It's not taking the WebEx. It says I don't, whatever it is, I have a problem. So I'm doing it via phone. Let's start the meeting then.
No.
Yeah, we have
Hello.
started, yes.
Yeah,
No
I'm Sandy, I'm on.
Hazel, I see you.
Great.
All right, Hazel. How
Yeah.
you doing?
Here's the-
Hazel, you can
Hi,
say
how are you?
welcome, welcome. I started it off. You can chime in. Go ahead. The floor is yours.
No, go ahead. Okay, I mean, you can, go ahead, you're on a roll.
All right.
All
Yeah,
right.
you got me feeling. You got me feeling like Brian Williams tonight. All right. All right. Let's begin. All right. So, all right. So, I just wanted to start out saying this is a very special meeting tonight because we're talking about something that is impactful in all of our lives, and that's the vaccine. A lot of times right now, a lot of people are a little skeptical. They don't really understand, what goes behind this situation. It is only a health crisis, so it kind of makes sense, right? So, people still need to be convinced. So hopefully this meeting will shed a little bit of light from, what to expect with the vaccine, how to get it, where to get it. And that was the whole purpose of having this COVID-19 vaccine presentation tonight. And I just wanted to start out before you guys start with the presentation, just to say that, we're glad you had the opportunity to come out and join us tonight with this presentation, because it's going to be very impactful and very informative. And people need to hear more of these. I know it's going on nonstop around, especially around the Bronx, but we got to keep doing it because, we want people to, we're in this together. And, the more people get vaccinated, the quicker we're going to return back to normal. Being that said, I'd like to open the floor, start it out. Before you guys chime in, I just wanted to introduce our guest speakers, Alex Jansen, right? And we have Carol Perez. You can briefly introduce yourself before we jump into tonight's presentation.
Hi, everyone. My name is Carol Perez. I'm a third-year medical student at Albert Einstein College of Medicine. I am originally from New York, from the Brooklyn specifically, and I'm very happy to be here.
Thank you. Thank you so much. Alex.
Hi, everybody. My name's Alex.
Hi.
I'm a first-year medical student. Originally, I'm from New Orleans, Louisiana, but I've been living in New York for the last 8 years or so. So I've really gotten to love the city. And like Carol, I'm very appreciative to be here. So thank you all for hosting us.
Glad to have you.
Thank you so much. All right, so we're going to start tonight's presentation. And at the end of the presentation, anybody that wants to ask open questions, we'll have a Q&A section towards the end. So let's begin tonight's presentation.
Yeah, I would just like to ask everyone to mute themselves who is not presenting right now. Please mute yourselves.
That's *6, correct?
Yeah.
Yes, to my understanding, yes.
Okay, everybody. So I'm going to share my screen. As soon as I do that, could somebody just let me know if they're able to see this PowerPoint? We can? Okay.
Yes,
Great.
I can see.
Yes, we can see it.
Awesome.
Perfect.
All right. So again, thank you all so much for hosting us. We're really excited to be here. And as was mentioned, we'll give the presentation, and then at the end, there will be time for plenty of questions that anyone might have. So to begin, as was prefaced just now, we are in the middle of a huge global health crisis. So vaccination is incredibly important right now. Although vaccination does exist, COVID is still a huge risk. In New York City, about 2,500 people are being diagnosed with COVID every single day, which is a huge number. This is just a chart comparing case rates of people who have been diagnosed throughout New York City. This is the black line, the Bronx, the gray line, and the 10461 area code, which is the pink line. And as you can see, the numbers are declining for April, which is a good sign, but at the same time, the case rates remain relatively high. And again, 2,500 people are still being diagnosed with COVID daily. And the decline in numbers, actually, it could be because partially contributed by vaccination, which is really a great thing, and another reason to be vaccinated in order to continue with the decline of people getting COVID. So the overall goals of vaccines are to protect each person by inducing an immune response that protects against someone from getting the disease. It might not prevent against infected, so someone might still get COVID or any other disease that a vaccine might defend against, but they might have severely reduced symptoms or no symptoms at all, which is the ultimate goal of any vaccine, is to reduce serious side effects and deaths. Also, to indirectly protect other people by reducing infection to others, something called herd immunity. So right here, if you can follow my mouse, this top line graphic is kind of what happens with diseases when there is no vaccine. Someone gets a virus, then they spread it to someone else, who then goes on spreading it, and it kind of just keeps going in an exponential manner. However, if enough people are vaccinated, if someone does get COVID or any virus, and they come into contact with someone who's immune, that person would then not spread it to someone else because they've been vaccinated against the virus. So that's the ultimate goal of vaccines, is to create such a large herd immunity that a virus is just no longer spread. However, it does take a lot of people getting vaccinated in order to get to herd immunity. Dr. Fauci's mentioned that for measles, it takes about 90% of people in order for herd immunity to be effective. So that's kind of the number we're looking at. So for people who might be on the fence of vaccines or relying on other people to get it, it takes such a large number of people in order to actually be protected by herd immunity. Quickly, there's this video that just briefly describes how vaccines work.
It helps to
Can everybody hear the video? Can somebody just give me a thumbs up or down?
look first at how the immune system works, because vaccines harness the natural activity of your immune system. There are about 100 trillion bacteria and viruses on your body. Not all of them cause disease, but some are able to get inside our bodies to multiply, and this can make us ill. There are barriers to stop this happening, but suppose some disease-causing bacteria do get through. Your immune system is quick to recognize them as invaders. This is because the proteins or sugars on the bacteria's surface have different shapes to any of the ones in a human body. They trigger a complex chain of events involving many different types of white blood cells working together. One type of white blood cell is able to make antibodies to fight the invaders. Antibodies can stick to the proteins or sugars on the bacteria's surface, and this kills the bacteria or disables them. However, not all antibodies will work against these bacteria. They have to be exactly the right shape, a bit like a key fitting a lock. Our bodies have a library of billions of white blood cells, each of which can make just one shape of antibody. Only a few of these antibodies will match the invading bacteria. Producing antibodies of the right shape can take several days. By this time, there could be billions of disease-causing bacteria in your body. Once the right cells are activated, they quickly divide and turn into a production line, making masses of antibodies that stick to the bacteria. Eventually, your body gets rid of all the bacteria. Antibodies remain in the blood, and some white blood cells may also become memory cells. If those specific bacteria invade the body again, the immune system will respond so quickly that you won't get ill. Vaccines work in the same way. They contain weakened or dead bacteria or viruses, or even just a few proteins or sugars from the surface. This is enough to convince the immune system that a real invader has got in. The same process takes place as when real bacteria or viruses invade our bodies, except you don't get ill. Afterwards, if your body ever meets the real thing, your immune system will remember it and get rid of it before you even know it's there.
Okay. So that was just a brief description of how vaccines work. If anybody has any questions about that overall process, definitely feel free to ask at the end of the presentation. Okay, so these are just some general types of vaccines that are created. As you can see here, some vaccines are live. However, not usually, and the COVID vaccine is not the live virus, so no one will ever contract COVID from getting the vaccine. And that's a really important point to realize, that the vaccine, it can in no way actually give someone the COVID-19 virus. So these are the available COVID-19 vaccines right now that have been approved, with the Johnson & Johnson we'll talk about a little bit more in a second. But I'm just going to go through each one. So Pfizer BioNTech is 2 doses. Each is 3 weeks apart. The vaccine has been approved for ages 16 and older, and it's 95% effective against severe disease. And again, this means that if someone were to contract COVID, 95% of the time, it's going to prevent against somebody getting severe disease or even any symptoms at all. Moderna vaccine, similarly, is also an mRNA vaccine, and it's also 2 doses. This is about 4 weeks apart. And like Pfizer, it's 94.1% effective against severe disease. However, in addition to that point, recent studies have also shown that mRNA vaccines are 90% effective against infection itself. So that means there is a 90% effectiveness against getting COVID at all, regardless of symptoms. The Johnson & Johnson vaccine, one of the benefits of it is that it's 1 dose. It's done in a different mechanism. It's not an mRNA vaccine. It's something called a viral vector. And it's 72% effective against severe disease and 86% effective against severe disease in the United States. And those are very, very high numbers. And no one who, and in the trials, I don't think anyone actually died who was given any of these vaccines. Well, I know on the news, if anybody's been following what's been going on with Johnson & Johnson, the vaccine's been suspended. I'm going to talk a bit about that in a few slides. So this slide right here is a lot of words. It's a lot of information. Most of this, ideally, will be spread out to everybody.
Alex, 1 second, Alex. If everybody can mute their phone, we hear a lot of feedback.
I'm gonna try to mute. 1 second.
All right.
Hello?
Yes.
Hello?
Whoever that is, can you just mute your phone?
I'm on the phone. Oh, you
I
want me
know.
to mute?
Yes, please mute it.
I'd like to.
Thanks.
Thank you. I'd like to go back to something I just said. I said that the Johnson & Johnson vaccine was suspended. I misspoke. It was just paused. So it hasn't been suspended for forever. It's just paused right now so that they can kind of figure out what's going on with it. And again, I'll touch on that in a few slides. So again, this slide is a lot of words. And the goal is for this PowerPoint to be shared and for people to have access to this information. But a few things that I would like to touch upon in this slide is A, is there anyone who shouldn't get the vaccine? And right now, the only recommendation for people who shouldn't get the vaccine are those individuals who have a history of severe allergic reactions to any of the vaccine ingredients included in any of the 3 vaccines. And if someone is unsure if they have had severe reactions to vaccines in the past, that's definitely something to speak with their primary care physician about, just to make sure. In terms of people who have lowered immune function or autoimmune diseases, right now, there's no data suggesting they shouldn't get the vaccine. And it's suggested for those individuals as well. Okay, so here are some of the common side effects for people after getting the shot. So actually in the arm where you get the shot, some common side effects could be soreness, redness, and swelling at the site of injection. And then throughout the rest of your body, and a lot of these side effects are caused by the body's immune response. And they can be tiredness, headaches, muscle and joint pains, feelings of fever, and chills. So kind of flu-like symptoms. It varies greatly person to person who gets side effects. I myself had a few side effects, especially after my second dose for about 8 hours, but then they went away. A few of my other friends didn't feel anything. So I think it really just depends on the person and how their body reacts to the shot. Serious side effects are very, very rare, but they have developed in some individuals because of that, and because these vaccines are relatively new. Most places giving out vaccines, there's a 15-minute waiting period at the site of vaccination to make sure that everyone's okay and that they don't suffer any serious side effects, because serious side effects do happen very quickly after the shot is given. So that's why we have this 15-minute waiting period, to ensure that everyone is okay and well enough to go home after the vaccine. This last point is something that, again, is not totally clear yet, but can people take medication to help with the side effects of the vaccine? Per the CDC, their website, they said that it's not recommended to take medication before the vaccination. The idea behind this is that it may reduce the desired inflammatory response to produce the appropriate immune reaction that is desired from the vaccine. So they recommend people not taking any medications before the vaccine, but if someone starts to feel symptoms, they start to get a headache or they feel feverish, at that point it is okay to take ibuprofen or Tylenol as recommended by somebody's PCP, or as might be appropriate for them. Again, if somebody is unsure about what medicine is safe to take with this vaccine, the CDC website has clear guidelines for this. Also, definitely contact your primary care physician to see what they say about it. And then, so the recent Johnson & Johnson, what's been going on is that there's been 6 reports out of about 7 million doses administered of people getting blood clots. And no one has died from these blood clots, but they have been found. So that's the concern. That's why they've paused the vaccine giving it out right now. But Dr. Fauci said yesterday that he expects the vaccine to resume starting on Friday. Now, to put this in perspective, however, you can kind of see the comparison between other blood clot causing events. The Johnson & Johnson vaccine is 0.000088% causative of blood clots, they think, whereas COVID-19 itself has developed blood clots in 20 to 30% of individuals who had that. The general population incidence is 0.1%. And for individuals taking birth control, hormonal birth control, there's a 0.3 to 1% incidence of blood clots. So as you can see, comparatively to other things, this is very, very low, which is why there is tremendous optimism from Dr. Fauci that the shots will resume on Friday, and for no one to be worried if they have gotten this vaccine. So right now, Carol will continue with the remainder of the presentation.
Thank you, Alex. So I'm going to speak about common myths about the COVID vaccine, which I believe has been a pretty big reason a lot of people have questioned whether they should get it or not. So I'll just go one by one. If you guys have any other questions at the end and any other myths that you would like to clarify, we would be happy to take those questions as well. So just to start, the first few ones that we have is, can the COVID-19 vaccine make me sick with COVID-19? And the easy and fast answer is no. As Alex mentioned, this vaccine is not a live vaccine, and that means that the actual full alive virus is not in the vaccine. So it cannot make you sick. There's no way that that virus can somehow reproduce in your system because it's simply not there to start with. Another common myth is after getting a COVID-19 vaccine, will I test positive for COVID-19 on a test? And again, the answer is no. If the virus can't get into your system through the vaccine, then there's no reason for you to test positive due to that vaccine. As Alex mentioned before, you can get the vaccine and still get infected after. That risk is still there. It's real, and we're not going to ignore that risk. But you will not test positive because of the vaccine. Another one is I've already had COVID-19 and I recovered. Do I need it again? We know that after any infection, our bodies naturally produce antibodies. So they produce these soldiers that are supposed to recognize these invaders the next time that they come into contact with them. And the second time that they come into contact with them, they're stronger and faster attacking. And it is true that people do have antibodies after having COVID. But that's also the biggest reason that we give vaccines in general, right? So that you can build that response without having to have COVID, number one, and number two, to build an even stronger response than that that you would build from getting COVID itself. Okay. And another one is, will a COVID-19 vaccine alter my DNA? And the answer, quick and easy answer, is no. None of the vaccines that are currently approved or that are being researched for use in the future, for approval in the future, interact with our DNA at all. Alex, do you mind advancing? Okay, thank you. So just three more myths that we thought about putting in here. One of them is it safe for me to get a COVID-19 vaccine if I would like to have a baby one day? Okay, and this is a very valid concern for any either currently pregnant mothers or someone that wants to have one in the future. And we believe that it is safe. As of now, there's no current evidence that the COVID-19 vaccination can cause any problems with pregnancy. And we like to say that we practice medicine, evidence-based medicine, and not anecdotal. So as of now, the evidence has not shown that there are any problems with the vaccine and pregnancy. Okay. Next one is, if I have a history of an allergic reaction not due to vaccines, so let's say peanuts or latex, should I get the COVID-19 vaccine? And then the answer is, everyone who has just a general allergy that's not due to the ingredients in the vaccine, it's still recommended that they do get the vaccine. There is a list of specific ingredients that will, in sharing this PowerPoint, we'll send those links as well, that lists out all of the ingredients in the vaccine. And I would encourage anyone to go through that list. And I think, it's valid for you to want to see those ingredients if you're planning on putting anything into your body. So you can look at those ingredients. But the vaccine is not contraindicated in someone that has just allergies in general, whether it be seasonal, whether it be to food or to other medications, only if it's an allergy to specific ingredients in that vaccine. Okay. And then one last one that we have is, will I or my medical insurance be charged for the vaccine? And the answer is no. The government is providing the vaccine free of charge to anyone living in the United States, regardless of their immigration or health insurance status. And as we know, we live in New York. We're a very diverse population. And we also, I'm sure a lot of us know people that struggle with these topics of immigration and health insurance and financial distresses in general. So I think it's very important to make that information known, that it's free and that no medical insurance is required. Okay, so who's eligible for the vaccine? So as of now, I'm sure most of us know that in New York, anyone above the age 16 and older is eligible for the vaccine regardless of their medical conditions, or as previously, age was a factor before. Now everyone above 16 and above is eligible for the vaccine. This also includes incarcerated individuals. And then children or adolescents younger than 16, the vaccine doses and effectivity are being studied currently. Last I heard, from 12 to 15 is the next bracket that's being studied and looking to being opened up. And that's more in regards, not so much to safety, because we are confident that these are safe vaccines, but it's mostly in regards to dosing. We need to get the dosing right, and it may not be the same in children as it is in adults. So those are the studies that are being conducted now. As of now, anyone younger than 16 is not eligible, but we encourage you to continue checking the nyc.gov site on the COVID-19 vaccine page to look for any updates for any family members or friends that have younger kids and are interested in getting their vaccines. Okay. So which vaccine should you get, right? Alex told us about the 3 vaccines: the Moderna, the Pfizer, and the Johnson & Johnson. And we encourage anyone who is interested in getting the COVID vaccine to get whichever one of the 3 is available when they sign up for an appointment. So just as reminders for these, remember that the Moderna and the Pfizer vaccines are 2 doses, and they have to be within a specific window apart. So the Moderna, 4 weeks apart, the first and the second dose, and the Pfizer, 3 weeks apart. So that's just important to keep in mind with your scheduling. If you're planning on, being away from a certain zip code where you have your vaccines, just keep that in mind, that you want to be in the same place 3 or 4 weeks apart if you're getting the Pfizer or the Moderna. For the Johnson & Johnson, if it is resumed, then that's just 1 dose, and that's kind of a quick and easy one to get. And then should anyone not get the vaccine, I believe that Alex already touched on this, but any severe allergic reaction to the vaccine ingredients is contraindicated. But as of now, no other contraindications. And then so you decide that you want your vaccine. How do you schedule it? So we have 3 resources here. And again, this presentation will be emailed. The first one is you can go to anyone joining over the phone. I apologize that you can't see, but I can read out the first 2. So the first one is the vaccinefinder.nyc.gov website. And all currently eligible members can sign up through there. You can enter your zip code and it'll come up with the next available appointment and location. You can also call and set up an appointment, and the number is 877-829-4692. And if you are a Montefiore patient, you can also schedule an appointment through Montefiore. And then the link is also available on our PowerPoint. One other resource, which will be on the next slide, is through Jessica Toro, which is the volunteer coordinator at the NIGC. And she's encouraged us to put her contact information here. And she says that she's very happy to assist anyone to make their appointments so that you don't have to call or go on the websites yourself. She'll assist you should you need it. Okay, so then you get your vaccine, and then now what happens? Number 1, you want to keep your documentation and your proof of vaccination. So there's an app that's called the NY State, so NYS Excelsior Pass Wallet, and we included the little icon here so you're able to identify it in your app store. Should you look for it, you can take you'll get a card, a physical card, and we encourage you to take pictures of that, we encourage you to also look at your My Chart if you're a patient, or if you have access to electronic records in any medical facility that you go to. They'll usually keep those on file, and that's a great place to have it. Should you lose your card, you still have that documentation. The other one is give feedback about side effects. So there are multiple links. They provide you with these links when you do get your vaccine. And this is so that if there are any side effects that, let's say the Johnson & Johnson with these increased blood clots, the only way that the government can know about this to investigate it is to know about it, right? It's if you report it. So we encourage you to report any side effects that you had, whether it be, chills, or whether it be something that may not even be related, but can be. It's still worth it to report it, just so that it's investigated further. And then just keep in mind that fully vaccinated means greater than or equal to 2 weeks after your second dose when it comes to the Moderna or the Pfizer. So not after the first, but the second. And then at least 2 weeks after the Johnson & Johnson, which is 1 dose. So remember, just because you got your 2 doses or you got your 1-shot dose doesn't mean that you're fully vaccinated at that point. We still want you to, take your precautions. And even after being fully vaccinated, we want you to continue your methods of infection prevention that we've all been doing from the start. And this is to protect yourself and to protect others. Remember that that rate of 95% and 94% and 80% of protection against severe disease doesn't mean that it's 0% of infection, and it doesn't mean that it's 0% of severe disease either. So we still want to protect ourselves. We want to wear our masks. We want to continue social distancing, and on this slide we put social distancing as advised. One of the most recent recommendations is that, it's believed that it's okay for vaccinated individuals to encounter other vaccinated individuals in closer proximities. So advisements like that, advisory statements like that, and then continue hand washing, right? And this is not only for the COVID virus, but, for other viruses and bacteria in general, but just at a highlighted stance right now because of COVID. Okay, and at this point, we'll take any questions. I know that there's some questions that have been coming through the chat. So I'll read them off little by little, but if anyone has a question that they would like to verbalize right now, please feel free to do so.
Hi. Oh,
All right. At this time, yes, we're gonna ask some questions. You can start, and I see Hazel could be next, so she has a question in the comments as well. Go ahead, Natalie.
well, first I want to say what a great presentation. Thank you for being so thorough and explaining the process of vaccines. That it was very helpful, because I think that's a large part of the issue. A lot of people don't understand or are educated in how this all works. But the first, I have a 2-part question.
Yep.
Possibly a 3-part, but 6 months. 6 months is what I'm understanding is the vaccination window, or the amount of time that you have to be safe, I guess, from COVID-19. Is that true? And the second question I have is I've been, starting to study about health, because I'm sure, because of the COVID-19 stating your health and your weight and things like that. So as I was researching that, I realized that there's a connection between vitamin D deficiency and a large amount of deaths is related to having a low deficiency in vitamin D. And then that made me think about people of color, because people of color usually have a low vitamin D levels. What is the medical community going to do about that, or educate people of color? Because I think that's a very important point that I don't think people are thinking about or talking about.
Yeah, no, thank you for your question. In terms of the educating, the public, I think it's definitely a huge point to make, and it's something that we're trying to do here, provide everyone with information, and then do with that, with these resources as you feel best for yourself. So with the vitamin D, I have heard about the vitamin D, and you are correct that in darker individuals, vitamin D is usually lower. From my understanding, there haven't been it hasn't been shown, supplementing the vitamin D in COVID patients hasn't been shown to make much of a difference when it comes to survival, or when it comes to morbidity, which is, we usually use that word in terms of outcomes for that patient. Did they do well? Did they do better? And from what I know, I don't think that it has shown to really improve that. And then, sorry, could you just remind me of your initial question was also the 6 months, right?
Yeah, right. There's
Yeah.
the vaccine only lasts 6 months. Yeah.
Mm-hmm. Yeah, and I see that you wrote or actually Hazel mentioned about the boosters in the chat. So I guess I'll answer both of those together since they kind of overlap. So as of now, we don't know. We don't have concrete evidence to say how long these antibodies last for, and that is something that's just going to come with time. We can't fast forward into the future and record information that we would have gotten, in this from now till then. And unfortunately, it's a waiting game right now. Everything with the COVID vaccine and with COVID in general has been very new, right? And I think it's very frustrating from the very beginning to not know much about COVID, to then not know much about the medications used to help people survive, and then to not know much about the vaccine and how long it's effective for. And I think it's frustrations that are shared throughout, those not in medicine to the community, and then those in medicine as well. And I think that the upsetting answer, but I think the only answer that we have right now is that we don't yet know about boosters. The committee of the NIH was actually asked about this, and this was just recently, just last week, and again, there's still no response, no concrete response or answer as to if we will need them. They are doing studies to get a better gauge as to this, and I believe that they are preparing for if we do need boosters, trying to prepare for that from now, so that we're not lagging behind and there's no gap in between our protection.
Thank you.
I just want to chime in and thank you for such a wonderful presentation. To piggyback off of Naomi, it was very informative and we appreciate it. But I also want to ask a question regarding is it mRNA technology? A lot of people have questions about this, and my understanding is it's been around for a while. So people have this notion that this vaccine, elements of the vaccine, has been out so short period of time, but in all actuality, NRA, am I saying this right? mRNA technology has been around for a while. I want you to explain this to us a little bit, and then I have a follow-up question. Go ahead.
Okay. So that is a very good question. It's very confusing how hearing about how all different types of vaccines work, and also you want to be as safe and effective as possible with everything. So that totally makes sense. So basically how mRNA vaccines work is that they contain material from the virus that causes COVID-19. And it helps give our cells instructions on how to make a little protein that's unique to COVID. So once our cells make copies of that protein that looks like the COVID protein, they destroy the genetic material, and then our bodies recognize that, and they start to build immunity against it, and remember it for the future. And again, a key point to remember is that little protein that looks like something from the COVID virus isn't actually COVID. It's just similar to it, and that cannot cause COVID in any way. So really what it does is it's like kind of a little fake that helps our body recognize it and make antibodies and immunity against it for the future. And yeah.
Appreciate that. Thank you so much. And the follow-up question I have is, you know, a lot of times people are very misinformed out here, and there's a lot of misinformation, and you know, people create their own realities or whatever they believe. Being that said, what do we tell somebody? What does the medical field tell somebody who says, "Hey, I had COVID and I have antibodies. Oh, it's gonna last me for a long time, maybe a year," and then next thing you know, they bump into COVID again and they got reinfected.
So you mean, what do you tell them as to convince them to get vaccinated, or to, sorry, could you clarify?
So yes, no problem. So the misinformation is that people have the notion that because they got affected the first time, that once they got over it, they have so many antibodies. Oh, it's gonna last me a year, blah blah blah. And next thing you know, I've actually met somebody that I know that got reinfected for the second time because of this misinformation and flat out ignorance.
Yeah, I think that's a, I think that that example that you say, you know, that person is a perfect example to other people that think like that, because they're proof themselves that having COVID one time does not protect you from a second time, and that we know right now that reinfection is very real, and that, you know, and it's not something that, again, it's not something anecdotally that I can tell someone, you know, hey, I had this patient and, you know, they had COVID before and now COVID again. It's something that, as you just mentioned, people that we know, people that are next to us and that are close to us are living this. And I think that that's so, that myth has been so prominent, and that unfortunately has taken so many people to get reinfected to demonstrate to others that this isn't just myth. This isn't just us trying to convince someone to get vaccinated. We don't, you know, we should have mentioned this at the beginning, but we're not getting paid. We're not sponsored by Montefiore or by any of the companies that make the vaccines to make these talks and to educate people about these vaccines. This is something that we are just seeing the benefit of, and that we want to spread that information for. So to someone like that, I would tell them to look for information in their own reading, in presentations like these, or with their own doctors, with their primary care providers, and to really just educate themselves about it. I think that at the end of the day, it really comes to risk versus benefit. Do you want to get reinfected with COVID and have the antibodies through that, and have to go through that, not only not feeling well, but the risk of having a much more severe illness through that? I mean, they got through the first one, hopefully they get through the second one, right? So do you prefer this pathway of getting sick and then getting your protection through there? Or do you prefer a vaccine that may make you feel not so well for a couple of days, but that won't make you sick, won't risk you actually dying from this?
I guess ultimately, how long is someone's antibodies last? The longest you've guys seen in the medical field, is it 6 months typically? You know, 4 months. I know some people that said they, you know, when they test the antibodies, they, you know, realize it wasn't there after like 3 to 4 months.
I think it's still a bit too early. That's why, as Naomi, I think your question was about the 6 months. That's why they're recommending it now. And as Carol mentioned, they're looking at the potential for boosters. And I mean, also back to the most recent question, COVID is just another virus, right? Obviously, it has very serious side effects and can lead to serious illness and death, but everyone has to get the flu vaccine every single year. You can get the common cold, you know, like 8 times a year. So it's not like reinfection is obviously very possible, and comparing it to kind of those other viruses and illnesses which do cause those, I think also kind of eliminates that idea that, oh, I get COVID, I'm fine for forever, you know.
So,
There's one
Darrell?
question. Yes, go ahead.
Yeah, there's some questions in the chat, and Joanne has her hand raised. I just want to let you know.
Okay.
Perfect.
I see the question. Once children are eligible to be vaccinated, will it be administered by their pediatrician? I'm actually not sure how they're going to do that. Carol, do you?
Yeah, I don't think at least I don't know, and I don't want to give information that I don't know, but I think that if it's anything like what we've seen for adults, it's going to be more of accessibility and capacity size. So with adults, we have been seeing that some PCPs are offering it, but we've also seen that we've opened some mass sites like the Yankee Stadium, or just because we're so close to it, Montefiore sites that I know about, where it's not necessarily a certain a PCP or a specific clinic, but it's just a mass vaccination site. And I think it's just because of time, it's a timely subject, and we want to get as many vaccines the fastest way possible. So I think it may include pediatricians, and it may also include these mass vaccination sites as well.
And then Joanne, you have a question?
Yes, Joanne, whoever's the next question could definitely ask now. Go ahead. I see your cat in there, Alex.
She loves Zoom or anything.
All right, I'm unmuted. Darn.
All right,
Okay,
go ahead.
so since I'm doing the minutes, you guys are from Einstein, right? Just to make sure.
Yes,
Right.
ma'am.
Okay. Thank you. Okay. Wonderful presentation. I wanted to know, where can you find a list of ingredients? My daughter-in-law says she's allergic to aluminum. She is, and I know that's a common ingredient in many of the vaccines. So where can I find a list that's an exhaustive list?
I'm gonna post a link in the chat.
Okay, great.
It has the link itself is going to have ingredients specifically for Pfizer.
Okay.
But on the left there is links to each one.
Great, thank you. The other question I have is there a link? This is PowerPoint is wonderful, and I wanted to share it with our Facebook Community Board 11 Facebook group. But is there a link that I can put on Facebook, like a web page or something that I can share this with our members, with our it's actual not members, it's the community residents.
Yeah, I think this is going to email it to Jeremy. They're going to email us the deck, right?
I actually emailed the presentation to Jeremy, to Sandra, and I believe to Joe.
Right, I think I have it.
Yeah, that I did email the presentation. Oh yeah,
Okay.
I did include you in it. Yeah.
All right, you can
Okay.
Yeah, just so that we would have it before.
But
Yeah,
even that email, though, can that be put into a web, like a link? I mean, I don't know. Now
That's
I'm trying to figure that one
technical
out.
question.
Okay, well, thanks a lot, Hazel.
Yeah, I think we could definitely
Thank you.
try. We can try, but I'm not sure as of now how to.
Okay. All right, thank you. Thanks very much.
Yeah, no problem.
All right, so Hazel, yeah, send me over the link if you can. I mean, the deck is if you can. I think Jeremy has it too. But anybody else has it?
I can send it out to you, and I can also have our tech person take a look and see if he can come up with a way to make it a link.
Absolutely, because this is going to be a collective effort by our community. This is going to be a collective effort by everybody to get people informed. Because, like we said, we have so much misinformation out there. It's just so counterproductive to getting back to normalcy. So this will be very important that we continue to spread the right information.
Sorrel,
Yes, go ahead.
it's Sandy. I thought
Sandy,
this meeting.
yes.
I thought this meeting was going to be taped, because that's what Jeremy had said to me, that they should be taped, and that should help us get all the information we want.
Yes, this tonight's meeting is recorded. Jeremy said he was having a little bit of technicality issues of posting it in real time on Facebook Live. So what he's going to do is actually, after today, he's going to put it online, and then we can start sharing it that way.
All right, so that it will be seen by quite a few people. All right, great.
Absolutely. I'm going to post it on my page as well, so that way people continue to see the right messaging. So
Right.
people are getting the right information versus the wrong information. All right.
And I
Appreciate that.
just want, and if I may, I just want to thank Hazel for setting up the presentation and the doctors for putting on a fabulous presentation. So I want to thank
Absolutely.
everyone for doing their share. Thank you.
Thank you so much.
Daryl, it's Lisa. Can I get a question in before we wrap?
Lisa, yes, definitely. And by the way, I want to say, Joanne, put Lisa down. She's present.
Yes, sorry, I joined a little bit late.
No, you're good. Go ahead.
My question is, and thank you. This was extremely informative. But I had a question regarding the time frames between the vaccines because, like I know you said Pfizer is 3 weeks and Moderna is 4 weeks, but that's not when they're being given. Like I got the Pfizer vaccine 4 weeks apart. My mother got it 5 weeks apart. So does that decrease the efficacy of the vaccine if it's not at exactly 3 weeks for Pfizer and exactly 4 weeks for Moderna?
So there's like a specific day window within when it still remains to be given. So as long as it was within that time frame, they've been scheduling everything so that it is within the time frame, so that it avoids having to repeat the whole process.
Yeah, but to your question again, I know that so there's a recommended, right, which is usually from what we were doing at Montefiore was, up to 4 days prior to your 3 week or 4 week mark, and then up to about a week or 5 days to a week after. I know that because of scheduling issues, there were some people that were getting it a little bit later. And I think that, you should still be reassured that you're still getting protection from it. Those windows are based again upon the clinical evidence and the studies that were done in approving these and showing their efficacy, right? These vaccinations, and that's where those numbers come in, those number of days. It's not recommended that you get another dose again if, let's say, your second dose was a couple of days outside of your window. It's not recommended that you get a third dose. We don't think that that's necessary. But we do, if at all, if it is possible, 100%, we want you to stay within that window. So I would say, like, if it's a 4 week mark, like for the Moderna, then no more than 5 weeks is our best bet with that. But ultimately, it's the fastest, the closest you can get it to your 3 or 4 week mark. That's when you want to get it.
Okay, so should I be concerned that my mom's was 5 weeks apart?
Yeah, I don't think so. Alex and I, we're not, we're not on that side of the medicine. So I don't want to say any information that I don't know.
Okay.
I'll have to, I can definitely look that up and get back to you.
Okay, I
But
appreciate that.
from what I know, it's not, you may have, there may be a discrepancy in, how effective it may be in general, maybe from the 95% to like a little bit less. But that's just a suspicion, again, it's not something that that we believe you're not fully vaccinated because, you went a couple days over. But I can definitely get back to you with that.
Okay, thank you. I appreciate that.
Yeah.
I have another question, Carol and Alex, for both of you. As you're going to be future physicians, as you know, we've had an equity issue where people of color are not able to get the vaccine or having issues or trouble. What would you recommend as physicians caring for everyone? How can we close these gaps with people of color getting the vaccine?
That's a big, heavy question.
Yeah, that's a
that
tough
I
question.
think is needed. Yeah, I think advocacy is a big component. And it's unfortunate that we need to even have these discussions about this and that we even have to mention, hey, I need someone to advocate for, like, it shouldn't be a thing, right? But I think that advocacy, in the reality of it, it's what we need. And that takes people like us, like this committee that's here, and leaders that really want to speak up for our community. And I think that it starts again. I'm big on education because when I grew up, my mom always said education is power. And I think that the more we educate our community, the more not only we can advocate for them, but they can also advocate for themselves and speak up and know about the disparities that they might not even be aware of. So I think having our advocates, and then also making those other parties aware. And when I say other parties, I mean people that are not of color aware of this, because it may be that some aren't, and that also takes education on their end. So yeah,
And
yeah.
And from the medical perspective too, like acknowledging that there's like a huge, serious systemic issue with that that pervades all society, and as the medical community, whether it's physicians, PAs, nurses, hospital staff, like as a full team, kind of taking ownership of that and being like, hey, this is going on in our like practices too, where like we are showing these biases, we're doing these things, and to address it in that sense as well, and kind of put the onus on, because like things are very much systemic, but at the same time, if you never take responsibility for what's happening like within the medical community, then nothing's going to change there either. So to acknowledge that and to have that as a step forward too, and say like, hey, no, like to really get to equity, we have to do XYZ, which goes into what Carol was saying about education, awareness, and advocacy.
Thank you. Very good.
I think making the vaccine sites more available. I know that the vaccines have to be frozen or kept at a certain temperature, but there really should be a way to bring, ice cream trucks are all over the place. You see Mr. Softy all over the place. Why can't we have vaccine trucks and go into our communities of color? Because, we've been trying to get our seniors to get vaccinated, and a lot of them won't travel because they're scared. So, we were lucky, and Jessica, and I have to thank Jessica, that really was a joint effort putting this together. But, we need to bring the vaccine to the people, because the people are having a hard time getting to the vaccine. Even though, we did have Yankee Stadium, that's 2 buses for some people, and that's a train and a bus for other people, and nobody wants to get on public transportation now. And our seniors can't afford getting cabs. We were able to get some of our seniors to take accessorize together, but some of them don't qualify, and some of them are just scared. I think that like I said, getting the vaccine to the people where the people are, I think would really make a big difference. And rent those ice cream trucks.
That's a great point.
Definitely a good idea.
Great point.
That's a great point, and that also highlights another like lack of access to transportation, to being able to actually get to the vaccine, which obviously is at a direct disadvantage for certain people. So yeah, that's something that's definitely a huge hurdle, and hopefully we're able to figure it out. Ice cream trucks sound like a good idea though.
Something like that. We got to get some of our local officials more involved in our district. I think that's one thing we have. I think we would get that going,
Yeah, and we would definitely, as like the Einstein COVID response group, I think, we would definitely support that. But I think it is very political. And those are kind of touching waters that I'm not very familiar with. I 100% agree with you in that we do need to do that. And as a student group, we were trying to advocate for having even just keeping the sites that we were vaccinating at initially, because they wanted to close everything down and just throw everyone to Yankee Stadium, and that's it, right? But it's something that I'm 100% sure that we would definitely support, and we'll continue to speak up for that as well.
All right. Anybody else have any questions?
just have a statement. I know I've been talking a lot tonight, sorry. Um,
No, you're good. Go ahead.
just have an announcement. I just found out today that Carl Heastie is having, he'll be giving out PPE equipment on Friday from between 2 and 4 at Boston Road and Edson Avenue. If I'm not correct, you can call his office to get the exact address, but he'll be giving out equipment. So I just wanted to let you guys know.
Nice. All right, guys. Thank you so much for the presentation. Thanks for the all this valuable information. Hopefully we can have you guys on in the future. Do another one of these, hopefully, just to continue to get people informed. And thank you so much. It was great. I just wanted to talk to Joanne.
Yes.
All
Yes.
right. Some of the
You have
names.
that info for me?
Yeah, we just want to figure out who's on this call and stuff like that before we, do another checking who's present. So there's a couple phone numbers here. We have the 347 ending 95. Can you just please say who you are? And then we got 71.
Yep.
All right, so nobody's replying to that. But Lisa, we have. Go ahead.
I think Carol and I are gonna log off if there's no other questions.
Thank you.
Thank you all so much for
Thank you.
hosting tonight. We really enjoyed it, and we definitely love to do this again in the future.
Thank you so much.
Thank you
so much.
Open invitation for you guys.
Awesome. Yeah.
Thank you.
Thank you.
Have a good night.
Bye.
Bye.
Good night.
Great job.
Great job. All right, so we're going to figure out who's on this call. We're just going to do another one of these roll calls to make sure we got everybody's name. I see Lisa there. I see Naomi. I have myself. We had Edit that was there earlier. She had to go. We had Joseph Bacon.
Right?
Sandra. Do we have Melanie? Melanie?
Melanie? I didn't
Yeah.
see her.
Okay. We have Hazel, and then we had Joanne.
But how about 614 ending with 09?
Yeah, no one answered that. That might be the member of the public. It could be just a public member.
I'm gonna, all right, and 718 ending with 46?
Anybody? 71846. Anybody? Okay.
And
I think
Vinnie
one of
Marie.
You have me down, right?
Yeah, one of those numbers had
I
to
have
be
you.
Sandy.
No,
Oh.
I got Sandy.
Oh, okay.
And Vinnie
Okay.
Marie? Are you still here, Vinnie Marie?
I think she left.
Oh, okay.
No problem.
All right, I'll have to figure that out. Well, thanks a lot, Zarel.
Definitely. Thank you, all of you guys tonight. I just want to do a motion to adjourn tonight's meeting. All right. So right now it's 8:09, and that ends tonight's equity, and health committee joint meeting. That was a lot to spit out.
Thank you.
All right.
This was a great
Pleasure,
meeting,
guys.
guys.
Okay, guys.
Yes, it was.
Thank you so much.
Thank you.
Okay.
Definitely.
Good night.
Thank all of
Good
you guys.
night.
Have a good night.
Bye.
Have a good
Thanks,
night,
everyone. Bye. Bye.
Take care.
Take care. How the heck? All right.
Joanne, you still there?
I'm here.
All
I
right.
almost left.
Don't leave yet. So you have everything?
I wrote down everything in the beginning. I'm going
not-
to, I wrote down everybody's name in the beginning except for those 4 people.
Yeah,
And
that could have been, that was weird. That could have been
I
members of the
know.
public. It could be
I'm
members of the
gonna
public. Yeah.
notify that there were 4 members of the public that were not
Okay.
identified. I mean, what else can I do?
Yeah.
I mean, they're mysterious. And then I'm not going to put down, that's why I wanted a link. I'm not going to put down, Jeremy always says, don't put down every single thing you put. So I'm going to just talk like briefly about what they spoke about, and then try to provide
Absolutely.
a link on the minutes.
Okay.
So, so I'm not going to, I can actually listen to this again, I think on Facebook. I'm not sure. I think so. Right?
I think so. Well, we definitely got to see.
Okay. Sounds good.